Hi, I'm Meg Callahan with Infectious Disease Special Edition, and I got the chance to be in person at MedID 2025 and see your talk about the relationship between the surgeon and the ID doc. And I thought it was really cool, so I'd want to talk about it more with you.
Fantastic. Well, thank you very much. I love the opportunity to talk about it. It's a really important topic for those who are surgeons and people who are interested in infectious diseases and people like me who are a little of both.
So could you introduce yourself and tell us a little bit about yourself?
Absolutely. So I'm Rob Sawyer. I'm at Western Michigan University Homer Stryker School of Medicine, Kalamazoo, Michigan. My clinical background is in general surgery and critical care, surgical critical care, trauma, and so forth and so on. But throughout my career, I've always been very interested in infectious diseases. That's where my research has almost always been. And therefore, my great interactions with both our medical infectious disease colleagues, but also our pharmacists and PharmDs who are very dedicated to infectious diseases is also an area I've just had a great time working with people.
Why do you think it's important to talk about the relationship?
Yeah, no, a fantastic question. If you actually just take a moment and think about it, antibiotics are really, really important. I'm going to talk a little bit about antibiotic stewardship and the appropriate use of antibiotics to try to prevent resistance. But of all the patients, for example, in hospitals, the surgical patients probably are exposed to antibiotics more frequently because not only do we take care of patients with infections, but almost all of the patients who get operated on in a hospital end up getting antibiotics prophylactically before they get an operation to make sure they don't get an infection or try to prevent infection. And therefore, the people who use antibiotics, surgeons are very high up on the list of most commonly doing that. And whenever you have a group that uses antibiotics a lot, input and interactions with non-surgeons who are interested in infectious diseases, again, pharmacists and medical ID people, is really, really important to make sure that we're doing the right things. We're doing things in line with what they think's, the most important way to use, these really important drugs. And therefore, stewardship, interaction, relationships are all very, very important.
What do you think the ID doc needs to know about the relationship that could maybe benefit the workspace? And then what do you think the surgeon should know?
The expertise is overlapping, right? If you think about it. So for the non-surgeons, generally expertise in antibiotics, specific antibiotics, bacteria, et cetera, other organisms. Surgeons tend to be experts in, obviously, surgery, but what can be done from a technical surgical standpoint to, say, treat an infection, right? So for the surgeons, when we're talking to our non-surgical colleagues, a lot of time the discussion and what we would want them to know is related to, okay, we either think we can do something as a surgeon or someone doing an intervention to help with this situation. Could be draining an abscess, could be removing, say, infected skin or something like that. That's really, really important. The other thing to always keep in mind is, at least in most institutions, infectious disease experts are consultants, whereas surgeons are normally the primary caretaker of these patients. And as surgeons, like any other caretaker of a person, if you're dedicated to working on that one patient, you are always most concerned about that one patient and trying to do exactly what's right for that one patient. And sometimes that makes us a little more, say, aggressive at things like giving antibiotics and so forth. So kind of an appreciation of I'm going to say, a little bit of anxiety surgeons may have when they're taking care of a patient who's had an operation, and maybe it looks like they have an infection, will tend to be a little more, again, aggressive about using antibiotics. So those two things are really important to know for non-surgeons, kind of what we can do surgically, and then the fact that we have this very close relationship with our patients, and sometimes it makes us think a little fuzzily. the other way around, having talked to a whole bunch of my infectious disease colleagues, again, pharmacists and medical infectious disease people, it is very important for them to continuously remind us as surgeons that antibiotics, they have side effects, they can cause resistance, they should not be overused, they shouldn't be used in situations where patients don't have an infection. That's important input that they give to us. The other thing, and I've talked about this a little bit with other groups in the past, is there is a lot of technology coming online now regarding both the diagnosis of infections, and those may be the ones which are based on, looking for DNA or RNA or something like that most surgeons don't have in their normal knowledge set. So how to use these new tests to make diagnostic decisions, that is where surgeons really could use a lot of help. And the other is there are maybe not as many new antibiotics as we'd like to see, but there are a lot of new antibiotics which have very specific reasons to be used and shouldn't be used outside of those. It's hard for a surgeon who doesn't, live in this world all the time to say, oh, well, this is the right time to use that really, expensive, unusual, hard to get antibiotic. But we need to know maybe when we do need to do that. And that's where our pharmacy colleagues and our medical infectious disease colleagues really can help us out. They can define, this is where you need to use something really unusual, exotic as an antibiotic. And we can always use a lot of help, try to make our antibiotic use better or more appropriate for an individual patient.
How are surgeons being measured in metrics in regards to infectious disease?
Well, I like to bring up the very first talking point I made during the talk, and that is one of the things that I think is always useful to remember when working with surgeons, if you're a non-surgeon, is what we get judged on and our outcomes related to infectious diseases are almost always post-operative complications that cause infection. So an infected wound or an infected abdomen after you've operated in the abdomen and so forth. None of the measures that people usually apply to surgeons are related to antibiotic use specifically. And therefore, that's why when surgeons think about infectious disease, a lot of times they're thinking more like surgeons and mechanically and, what technically did I do wrong that led to a complication, and not so much thinking about the appropriate antibiotic use. And that gets a little bit back again to how medical infectious disease people can continuously remind us that it's an important topic.
Thank you so much for taking the time to talk to us.
Thank you very much. It's been my pleasure.
Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.